Hi everyone, this is Victoria. So next we're going to go over the DSM-5 criteria for gender dysphoria. First, a few important notes. So it's important to note that gender choice is not the grounds for diagnosis with this disorder, but it's about the discomfort that people experience when they're living a life that others would say is typical for the anatomy that they were born with. So sometimes this distress can come if there's not social acceptance or if medical interventions are not available to support someone's gender identity. There are some advocacy groups and practitioners that don't believe gender dysphoria should be included in the DSM because personal preference should not constitute a diagnosis of mental illness. But other clinicians believe that gender dysphoria should be included in the DSM because it helps people who are experiencing discomfort with their gender assignment. This inclusion helps people who are feeling uncomfortable with their gender assignment get reimbursed or covered by insurance for the appropriate psychiatric and medical treatment. Gender dysphoria also includes gender identities that go beyond stereotypical binary gender types, such as male and female. So first, we are going to look at gender dysphoria in children. And this is the criteria, which is as follows. A is a marked incongruence between one's experienced gender and assigned gender of at least 6 months duration, as manifested by at least 6 of the following 8 characteristics. So one of the characteristics has to be this first one, which is a strong desire to be of the other gender or an insistence that one is the other gender. So the child can deny that they are the assigned gender or become upset if someone else insists that they are the assigned gender. Then the person would have to be experiencing 5 of the following. In boys, a strong preference for cross-dressing or simulating female attire, or in girls, a strong preference for wearing only typical masculine clothing, and a strong resistance to wearing typically feminine clothing. This means the child would have a preference for clothing typically worn by the other gender and a resistance to wearing clothing common for their assigned gender. Or they could use other items to make clothing typical for that gender identity. For example, some boys will want to wear dresses or use aprons to make skirts and scarves to mimic long hair. And girls will want to cut their hair short and wear looser clothing. The next is a strong preference for cross-gender roles in make-believe play or fantasy play, such as boys wanting to play the mother role during pretend play. So the fourth is a strong preference for toys, games, or activities stereotypically used for the other gender. The fifth is a strong preference for playmates of the other gender. The sixth is, in boys, a strong rejection of typically masculine toys, and for girls, a strong rejection of typically feminine toys. The seventh is a strong dislike of one's sexual anatomy. So some children may refuse to urinate standing up or sitting down, depending on their identified gender. And the eighth is a strong desire for the primary and or secondary sex characteristics that match one's experienced gender. Criterion B again highlights the importance that this condition is associated with clinically significant distress or impairment in socialization, school, or other important areas of functioning. For instance, children may refuse to go to school or attend public events. Not all people experience distress or discomfort that would have them meet criteria for gender dysphoria. So the DSM wants us to specify also if there is a disorder of sex development for this diagnosis. And then next we're going to look at the criteria for gender dysphoria in adolescents and adults. Starting with criterion A, which is very similar to that in children, a marked incongruence between one's experienced gender and assigned gender lasting for at least 6 months, with 2 of the following characteristics. A marked incongruence between one's experienced gender and primary or secondary sex characteristics, or in younger adolescents before puberty, the anticipated secondary sex characteristics. The second is a strong desire to be rid of one's primary and or secondary sex characteristics because the difference between their assigned gender and the gender identity. So sometimes younger adolescents will try to reduce noticeable signs of puberty, such as binding genitals to hide erections or binding breasts to cover growth. The third is a strong desire for the primary and or secondary sex characteristics of the other gender. So some people experience their current genitalia as disgusting or shameful. The fourth is a strong desire to be of the other gender. The fifth is a strong desire to be treated as the other gender. So for instance, the person is wanting to be called by a name more associated with the identified gender, or wanting others to use pronouns of the identified gender, such as he and him, she and her, or they. Some people may not attend functions that enforce gender norms, such as high school proms or other professional events. And the sixth is a strong conviction that one has the typical feelings and reactions of the other gender. So for criterion B, again, it highlights the importance of a person experiencing clinically significant distress that's affecting other areas of their life, such as work and socializing. Adults and adolescents that experience gender dysphoria are at a higher risk for suicide and depression before a gender reassignment surgery. The clinicians should also include specifiers, such as if there is a disorder of sex development, and also if the person is post-transition to the identified gender using like a hormonal treatment or a gender reassignment surgery. You can also know if the person is preparing to undergo medical intervention.